How do we know when asthma is controlled? Is basically by asking the question, how often do you use your rescue inhaler? If they're using it more than 2 times a week, we know that asthma control is not a goal. At that point, you want them to be on a prophylactic medication, and that includes something like Symbicort, which is a combination of a long-acting beta agonist, a bronchodilator, and an inhaled corticosteroid. So that's the initial question that you can ask regarding asthma control. You also ask what kind of symptoms you have when you get asthma, or you have currently, like wheezing, coughing, shortness of breath, or chest tightness. The other thing you want to know is you want to ask is about any factor that can be triggering the asthma. It could be that they're smokers or exposed to secondhand smoke. It could be a viral infection that they have, or it could be allergic rhinitis. Acid reflux could be one of the reasons, because when the acid goes up, it burns the the lung tissue, and that you breathe it in, you breathe the acid in as it goes up into the nasal area, and then that causes trigger asthma. Some people have silent reflux. Also, the use of certain medications like Motrin, Advil, that can cause reflux, and also beta blockers can can make asthma more apparent. So then you can ask also about compliance. Are you using the medication? Most people have difficulties being compliant with the prophylactic medication. The prophylactic medication, it's not supposed to provide relief right away, so they don't see the benefit, so they stick to the rescue inhaler. Also, some people might not know how to use the pump, and that doesn't help with the condition. Also, you want to treat the comorbidities such as reflux and allergic rhinitis, and you want to avoid also triggers. Depending on what the trigger is, if you have carpets in the house, then that would make it harder to manage the asthma. So that's the way you evaluate whether or not the asthma is being controlled. Now, if somebody comes, so how do we know when to send somebody to the emergency room? Basically, if somebody uses rescue inhaler and it's not better, you wait 5 minutes. You use it the second time. If it's not better, you ask them to go to the emergency room. If they come into your practice, you can give a nebulizer treatment. You wait 5 minutes. If it's not better, the wheezing continues, then you send them to the emergency room. You call 911 for them to be taken, because it's supposed to get better within 5 minutes of using the rescue inhaler, which includes ProAir. That's one of the ones that we use, Ventolin and Proventil. They are all short-acting beta agonists. If they're using the pump more than 2 times a week, and we know that their asthma is not controlled, then you add a preventive medication such as Symbicort, which is a combination, or Advair. Also, Brioellipta is another one. If you just want to give an inhaled corticosteroid, you can use Flovent. And there are other ones like Pulmicort, Asthmanex. Then, if that's still not controlling the asthma, if still they're having more than two episodes of asthma, or 2 episodes of needing rescue inhaler a week, then you can add Singular. Singular is a mast cell inhibitor, what they call a mast cell stabilizer, and that you take once a day. But if the person has psychiatric conditions or psych concerns, you got to be careful. You tell the patient when you give it, if you become suicidal, then stop the medication. The other thing that you want to do is you want to address all the comorbidities such as allergic rhinitis, and you give Flonase and loratadine. Or the acid reflux, you address with famotidine or a PPI like Nexium. And then you also want to order blood work. If after doing all this still not controlled, then you get a CBC and you're looking for eosinophils. If they are greater than 300, this might be the type of asthma that will require a biologic, and you refer them to the allergist or the pulmonologist to start that treatment. Remember, you are not alone. If you feel like the asthma, you're trying to do your best to control it and it's not controlled, you can always refer him to a pulmonologist. You can always refer him to an allergist. If you feel the reflux is not being controlled and that's contributing to the asthma, you send them to a gastroenterologist. So that would be the main way of treating asthma. In regards to the medication that you want to, know, is that if you give them, inhale corticosteroids, you want to make sure that they rinse their mouth, because otherwise